Across Zambia, government working together with partners continues to make steady progress in improving access to safe and clean water, sanitation, hygiene, working together to reach communities most at risk. Yet, when disease such as cholera strike, the need for timely, coordinated action becomes even more critical. Today, a different story is unfolding. A story of preparedness, resilience, and hope. Zambia Red Cross Society, ZRCS, with support from the International Federation of the Red Cross and Red Crescent Societies, IFRC, and funding from Foreign Commonwealth and Development Office, FCDO, has been implementing the Case Area Targeted Intervention, Cati, across the country. The Cati project is a focused approach designed to strengthen cholera preparedness and response. It aims to control and eliminate cholera outbreaks by expanding interventions into priority areas for multisectoral interventions, PAMIs, while improving water, sanitation, and hygiene systems in selected cholera hotspot communities. Across 8 provinces, health workers and community-based volunteers have been trained in early detection and rapid response to cholera outbreaks. A total of 424 health workers and 294 community-based volunteers are now better equipped to act quickly, detecting risks, reporting cases, and protecting vulnerable communities.
Tulebomba pomulando no kuchengerera obulwaire bwa kolera nifi tuleseyesha okutema moshi kusambisha abantu pomulando nefe bengayikingirira ku bulwaire bwa kolera makamaka ffe tungasunga amenshi yakonwa nefe yakolya ffe tungasunga amenshi yakonwa nefi amenshi yantu tulebe bonfya yakonwa tufe twabika mu chlorine nife tuleba sambilisha ate tukote chlorine tufe twabonfya okwipika chimbi fyakulya tufuye kulya fyakulya ifyayipikwa bwino kabiri fyasungwa bwino kupikapo kabiri byonse tulefwa okulya tufuye twabonfya fyakaba tejo cheka byonse tulefwa okulya fyakulya tufuye twasamba kuminwe byonse twafuma ku toilet tufuye twasamba kuminwe tulesambisha efyo abali na manga lefwa kupera omwana ebere afira samba kuminwe potati ila lepera omwana ebere nsheri minwe clean.
At Nakoli Health Post, a borehole has been drilled and will be equipped with a solar-powered water reticulation system supporting the health facility, providing surrounding communities with access to safe and clean water. Kasumbalesa is one of the busiest border trading points between Zambia and the Democratic Republic of Congo, DRC, bringing together people of different nationalities engaged in daily cross-border trade. With such high movements and interactions, access to safe and clean water is essential not only for business but for protecting public health. Through the Cati project, a borehole has been drilled at Kasumbalesa Mobile Unit Police Camp and will be mechanized into a solar-powered water reticulation system, providing reliable water supply to Kasumbalesa and Komesa markets. Similarly, PP Zambia Health Post in Chilabombwe and Jasmine Streets Primary School in Kabwe are being upgraded from hand pump boreholes to mechanized solar power system, enhancing access to safe and clean water for pupils, patients, and surrounding communities.
We continue appreciating Zambia Red Cross for the 2 pledged boreholes that are going to be put up there in the market, one in market Kasumbalesa and at the PPAZ clinic. So this is something that we really value to improve the quality of life that our people out there are having and improve even in the fight against any epidemics that are waterborne.
Change is strongest when it begins at household level. Through door-to-door sensitization, over 3,000 households have been reached with life-saving messages on disease prevention, treatment, and hygiene promotion. Because informed communities are empowered communities.
So in response to the outbreak that we faced at the district, we've undertaken so many activities, among them being radio sessions. We've had radio jingles being played on radio, as well as a few radio discussions. We normally have one session in a week to just reinforce or maybe raise awareness in the community about the cholera disease, and also putting an emphasis on the 3 C's that people need to be aware of. Then we've also put efforts in doing door-to-door mobilization, that is at household level. And our main focus is hygiene promotion, as well as distribution of chlorine, and also just educating the household owners on the use for the chlorine that they receive from Ministry of Health. In addition to that, we've had the public address system being done in the district, where we go around in the hotspot areas mainly, doing announcements, or as usual on the cholera disease, putting an emphasis on disease prevention and control.
Preparedness also means being ready to respond. Over 12,000 cholera hygiene kits were donated to the Ministry of Health to support the ministry in responding quickly to cholera outbreaks. These kits contain essential supplies like oral rehydration soap, multi-purpose bar soap, chlorine, zinc tablet, and water storage containers. The Cati project goes beyond cholera by integrating support for vulnerable children under 5 and pregnant women who are at risk of malnutrition. With the donation of 115 by 25 kg high-energy protein supplements HEPs to Central Province Health Office, families will receive critical support to prevent malnutrition and build healthier futures.
And within this project, we have been able to work very closely with the Zambian government in implementing the Cati project. The scope of the Cati project entails mainly to support communities and subnational health structures in ensuring effective preparedness and early response to cholera. The scope of Cati, the case area targeted interventions, is really to help in curbing and containing cholera outbreaks at the point where they start, targeting households around cases where they have been identified and delivering targeted sets of interventions to addressing them.
The impact of the Cati project goes beyond its immediate response, strengthening systems, empowering communities, and building resilience for the future.
So as we come to the close of the first phase, we are hoping that by the time we close, we'll have more communities having, understanding of Cati, but more than that, that we have these Cati response teams in place, working very closely with the Ministry of Health to support the cholera within the district level. And then even as we move forward, we hope that we can continue with this partnership, having a very strong partnership with ZRCS and IFRC and FCDO, basically, that we have a holistic way of working together to eradicate cholera in Zambia.
And we are hoping that increasing these facilities in Zambia would reduce the cases of cholera, to ensure that the communities are able to access clean water in a number of years to come. They are able to maintain the system that we have received also, and ensuring that even the trainings that they have gone through will really help them to ensure that they are able to maintain hygiene environment, clean environment, and we fight cholera together. So we do appreciate this support, and thank you very much, and we hope the support will also continue to ensure that the support goes to other areas within the country.
These efforts by Zambia Red Cross Society are aligned with its 2026-2030 strategic priorities, enhancing preparedness and rapid response while expanding equitable access to health, water, sanitation, and protection services, particularly for women, youth, and vulnerable groups. Zambia Red Cross Society extends its sincere appreciation to the government of the Republic of Zambia for its leadership and commitment to public health. We also acknowledge the continued support of the International Federation of the Red Cross and Red Crescent Societies, IFRC, a global network and the coordinating mother body for the Red Cross movement, whose guidance strengthens our collective impact. Our gratitude goes to the Foreign Commonwealth and Development Office, FCDO, for its generous support in making this work possible. To our communities, volunteers, and other partners, your dedication, coordination, and commitment continues to drive lasting impact. Together, we look forward to building on this progress, strengthening resilience, saving lives, and creating healthier, safer communities for all.